right, 10 seconds elapsed there, and we're going to start up again with the Health Finance and Policy Committee hearing, which we are resuming after taking a brief recess. And the next hearing, the next bill on the agenda is House File 486. Representative Feist is here, and since she's not on the committee, the chair will move that House File 486, the first engrossment, be laid over for possible inclusion in our finance bill. And Representative Feist, welcome, and please tell us about your bill.
Thank you, Madam Chair. Thank you, committee. In 2016, the Minnesota Department of Health and Department of Education, in collaboration with NAMI Minnesota, piloted the Cognito Suicide Prevention Training in Minnesota. This program offers a series of online professional development modules designed for schools to increase educators and other school staff's skills, confidence,
Representative Feist, you have frozen on us. I think you're the only one that's frozen here, because I think everyone else.
My internet is unstable.
Okay, well, go ahead and do it without the camera then, following on what Representative Kwam was telling us before we started. Go ahead.
Sometimes it works. Okay. So where did you lose me?
Well, start pretty much at the beginning.
Oh, shoot. Okay. So in 2016, the Department of Health and Department of Education, in collaboration with NAMI Minnesota, piloted the Cognito Suicide Prevention Training in Minnesota. This program offers a series of online professional development modules designed for schools to increase educators and other school staff skills, confidence, and willingness to intervene with students in distress. It includes 3 online interactive courses, each targeted to school staff working with a specific age group. This was a very positive response, or there was a very positive response to the training. Teachers and principals felt it was thorough, easy to use, and increased their confidence in supporting students. In 2019, the legislature authorized funding to make this suicide prevention training available across the state. The program was launched in May 2020. There have been 75 schools, districts, charter schools, private schools, and tribal schools participating, and so far, 4,885 teachers and staff have activated their account, and 4,054 have completed the training. It satisfies the 1-hour requirement for suicide prevention training for educators, as determined by their district. So there is also an incentive for schools to offer this to their teachers. This bill has already been heard in substance by the Education Finance Committee. We are presenting it before this committee because the funding will be redirected from the Department of Education to the Department of Health, which has the capacity and knowledge to administer the Cognito training and led the last initiative. The interagency agreement process takes time to execute that can otherwise be used for actual programming time. At a time when we know our students are struggling with their mental health, it is more important than ever to provide the best training possible on suicide prevention, and I urge the committee support. We have available Stephanie Downey, the Suicide Prevention Coordinator at MDH, and she'll share some basic details. And then Sam Smith from NAMI is also available to answer any questions. And I'm going to try to turn my camera on, and if I freeze, I'll turn it off again.
All right, thank you, Representative Feist. We appreciate that. And Stephanie Downey from the Department of Health. We're happy to hear from you on this bill. And what I would like to hear is a little bit about the funding, because I understand Representative Feist explained a little bit, but the funding was switched from the Department of Ed to the Department of Health. And when I spoke to the chair of Ed Finance, he said that was the agency's request. So I found that a bit curious. I don't often get an agency asking to have the funding coming over to its budget. So I would like a little bit of understanding of that. Ms. Downey, please.
Yes, good evening, Madam Chair. And as Representative Feist mentioned, the project was a collaboration between the Department of Education and the Department of Health, and both agencies had funds in their budget and the Department of Health staff having the capacity to coordinate and take the lead on the project over the staff from input from the staff from the Department of Education. Our staff at MDH had more capacity to coordinate the statewide rollout. So that's how the request came about in this last biennium, last year that we rolled it out. Our department staff took the lead on rolling it out across the state. So having the funds within the MDH budget would allow for us to continue to provide the program without a gap.
Okay, thank you. And I see that Lisa Timian from the Department of Health also wants to chime in here. Welcome.
Hi, yes, thanks, Madam Chair, and thanks to Stephanie Downey from our team. For the record, I'm Lisa Timian. I'm the Legislative Director at MDH. This was something that I also had not had experience with before in terms of switching how this was working, but at the request of leadership from the Department of Education and from the team working on this at Department of Health, they had just asked if we could send the funding directly to MDH, still working closely in collaboration with MDE, just to make this a little bit more straightforward and to have to spend a little bit less time on the interagency agreements, just with everything else that we are doing right now.
Okay, thank you for that explanation. Was there another testifier, Representative Feist, or just for questions, I think, right?
Thank you, Madam Chair. Yes, Sam Smith from NAMI was just available for questions. And if the committee is interested, Ms. Downey does have a PowerPoint presentation with just some basic facts. But if you're not in need of that because you feel that my presentation was so persuasive, then that's fine too.
Well, I think it was very persuasive, Representative Feist, and I know that suicide is a huge concern. And, you know, I don't think this committee needs to be told really too much about that. I guess the only question that I would have is whether there's any way or any attempt to track the efficacy of this particular training. I know it's hard when you're tracking how well something prevents an event, but you know, is that part of the department's plan here to? Because obviously there are different ways to do this kind of training, and it sounds very positive from the explanation. But is there data collection going on? Ms. Downey, maybe you could address that.
Yes, Madam Chair, there is post-training surveys that go out to all of the participants. Actually, there's a pre and a post with a number of questions about what they thought of it and how it changed their skill level and confidence in responding and communicating with youth. So we have that data. There's also a 60-day post-training survey that goes out. So we're able to collect data from the participants 60 days after participating in the training to see how their thoughts and feelings about the training, and have they identified any youth at that time, 60 days following the training.
All right. Well, thank you for that. Thank you very much. So I'm not seeing any other member questions. Representative Feist, would you like to have a final? Oh, I do see one. Representative Bierman.
Thank you. Thank you, Madam Chair. And I do have a question. I know Representative Feist gave some, or maybe it was Ms. Downey gave some numbers about the numbers of people who have opened the training and done the training. And I appreciated your question, Madam Chair, on the efficacy. So my question is, were those numbers based on just this past year or a year ago? And, you know, in what we've all been through with COVID-19 and the issues about suicide prevention during a pandemic, I know there's been a lot of conversation and discussion about that. But I wonder, with the department here today, is there any data as far as the number of suicides in the last year versus previous years available yet, or is it still too early? I've been told they don't get that data quick, but I'm just asking since people are here today.
Ms. Downey?
Yes, Madam Chair and Representative Berman, you are correct. Usually there is a delay in data, but there has been some preliminary look at the numbers of suicide deaths for the first part of 2020. However, knowing that that is all preliminary data, the numbers of suicide deaths are actually closer to the number of suicide deaths in 2018 from the time period, like the first part of the year, I think up through October is the time period that they looked at that data. And the numbers are comparative to 2018, which were lower than the 2019 numbers for that time period. So not at this time have we seen an increase, but we don't have the full data for 2020.
Sure, Madam Chair.
All right, Representative Bierman. All right.
Thank you much just for that. It was, good to understand. It's been a very traumatic year for a lot of people, and mental health is critical, and it's just something we're all discussing. Thank you very much.
All right, thank you. And Representative Feist, final word?
Thank you, Madam Chair. Thank you so much for the opportunity to present this bill. As the mother of 2 kids in school, having seen just how much they've struggled over the past year, I just feel really strongly about this bill and about this training. I'm just really honored to be carrying this bill and would encourage everyone to support it. Thank you.
All right, well, thank you so much, Representative Feist. We appreciate that, and to the testifier as well. And with that, House File 486 is laid over for possible, I should say the first engrossment is laid over for possible inclusion in the finance bill. Thank you. Next bill on the agenda is House File 1131, Representative Reyer. And so Representative Reyer, as a committee member, it's her motion that House File 1131 be laid over for possible inclusion in the finance bill. Representative Reyer.
Thank you, Madam Chair and committee members. I appreciate the opportunity to present House File 1131 to you today, the last bill in our committee doubleheader today. So this is a simple but important bill. It adds a dentist as a member of the Rural Health Advisory Committee. I first became interested in this issue at a meet and greet with a group of dentists 2 weeks into my first term in the legislature, just back in January. A dentist had occupied the at-large seat, which then turned over to a pharmacist, leaving dental care unrepresented. Now, I'm the daughter and niece of pharmacists, so I certainly see the value of having this profession at the table. But with the crisis in dental access, including but not limited to medical assistance in Minnesota Care, I believe we are wasting an opportunity to gain a more comprehensive view of the health needs of rural Minnesota. For example, in 2018, the Rural Health Advisory Committee published a report entitled Strengthening the Oral Health System in Rural Minnesota. This report highlighted disparities and provided possible solutions for improving care. It's clear to me that ongoing participation by a dentist will only improve the contributions of the advisory committee. And it's also timely in light of the strong focus on dental issues this session. For example, the proposed dental homes pilots, which also seek to address shortfalls in dental care. For the record, I've heard no opposition to this bill, and also just heard from Delta Dental of Minnesota that they support it. With that, I'd like to turn it over to our testifier, Dr. Michael Zakula, to discuss his experiences as a past member of the advisory committee. Thank you, and I'll look forward to your questions and ask for your support.
All right, thank you very much, Representative Reyer. Dr. Zakula, welcome.
Thank you, Madam Chair. My name is Michael Zakula. I practiced orthodontics up in Hibbing for 35 years, served as president of the Minnesota Dental Association, and presently involved with rural dental programs, loan forgiveness initiatives, and I also serve on the admissions committee at the School of Dentistry. So thank you, Chair Liebling, Representative Reyer, and committee members for allowing me to testify in support of House File 1131. As a former member of the Rural Health Advisory Committee and chair of its work group that compiled a report strengthening the oral system in rural Minnesota, I strongly believe that a dentist is an essential member of this committee. The interrelatedness of oral health care and overall well-being is indisputable. A rural health system that does not routinely include dentistry in its decision and policy-making progress will never achieve optimal health for its patients. In rural communities across the state, dental clinics play a critical role in providing care to these communities. A practicing dentist in these communities can provide input and advice on the significant barriers that outstate Minnesota is experiencing, that include access to care and workforce shortages. While Minnesota has some of the best oral health outcomes in the country, there are significant disparities between care in urban and rural areas of the state. Geography should not dictate what kind of a service a resident receives. Dentists can provide comprehensive input in regards to the development of holistic health policies. They are the primary director of dental care and of the dental team, therefore bearing the ultimate responsibility for a patient's dental health. The interrelationship between dental health and overall health is a strong component of the core education. So the Rural Health Advisory Committee's mission is to advise state leaders on rural health issues. This proposal of adding a dentist as a permanent member to the committee will certainly help facilitate interprofessional communication and improve the overall quality of what the committee brings forward. Thank you.
All right, well, thank you very much, Dr. Zakula, for being with us this evening. Any questions from members? Any final words, Representative Reyer?
Actually, thank you, Madam Chair. Actually, just to thank Dr. Zakula for coming back a second time today and making so much of your time available to us and bringing your testimony. I ask for your support. I think this is a very useful step for our state. Thank you.
All right. Well, thank you very much. And so with that, House File 1131 is laid over for possible inclusion in the finance bill. And with that, members, we have concluded our agenda for the day and we stand adjourned.